Hi, this is Shinpei Sagi, and I would like to talk today about the mesenchymal stem cells, its future perspectives and current knowledge. And first of all, I would like to introduce myself. I graduate Kobe University and had a clinical experience, which was major in internal medicine and autoimmune and rheumatoid diseases, and work as a rheumatologist, and study abroad at NIH, so major in immunology, and come back to Japan and do research about the mesenchymal stem cells, which is MSCs. And this is the 5 major functions. So first, the MSCs repair tissue damage and restore function. And second, they have anti-inflammatory effect, which inhibits the inflammation in the body. So it's expected to have an anti-aging effect on arthritis or skin or blood vessels. And they also have an antioxidant effect, which reduces the active oxygen and prevents cell aging. And fourth, they control immune systems, which is expected to be effective against the allergy, or which is like atopic dermatitis or autoimmune diseases like rheumatoid arthritis. MSC also increase the bloodstream and create new blood vessels to improve the blood circulation. And how MSC repair the tissue damage, the MSCs are capable of differentiating into the several cell types, including osteoblasts, chondrocytes, myotubes, stromal cells, fibroblasts, and adipocytes. MSCs are normally present in all tissues, but have mainly been isolated from a bone marrow or muscle, adipose, or umbilical cord tissue. And in a clinical setting, MSCs are being explored in trials of various conditions, including neurodegenerative disorders, osteoarthritis, traumatic cord injury, liver cirrhosis, type 2 diabetes, dyslipidemia, COVID-19, cardiovascular diseases, autoimmune diseases, brain infarction, IBD, chronic fatigue syndrome, bone fracture, sarcopenia, and allergy. There's a lot. And people sometimes ask me how many MSCs injection do I need for effective results. It's case by case. But some conditions may respond well with only one just stem cell injection. This is surprising, while others may require periodic treatments for a maximum benefits. This all depends on the condition being treated as well as the severity of the condition. And I would like to explain why I have been so attracted to the MSCs all my life, because this is an ultimate anti-aging therapy, which I believe, because I saw many patients who received the MSC treatment. All of them experience they have a high energy, better sleep, stress resistance. Some people look younger, and they experience a boost brain power, and also they have a healthy lifestyle. Their lifestyle changed. But surprisingly, some people experience a reverse atherosclerosis. This is incredible, because no one believes that we can reverse the atherosclerosis. And as I am the rheumatologist, and I am interested in the autoimmune rheumatoid diseases, I will show you that the MSC may cure autoimmune rheumatoid disease without side effect. And the autoantibodies, they drive the systemic autoimmune response and cause the autoimmune diseases. And in a rheumatoid arthritis patient, the autoantibody is called rheumatoid factor, which is RF. And other autoantibody, which is called anti-CCP antibody. These two autoantibodies drive the diseases progression And here's the data that the MSC suppress the production of the both two autoantibodies. You see the pre-treatment, 1 year post-treatment, 3 year post-treatment, you can compare. There's a statistically difference. And the same paper that the MSC rapidly attenuates the rheumatoid arthritis. As you can see that before the treatment, you can see that the deformity of the finger and swelling joints. However, the finger it's straight and the swelling joint is improved, which is very surprising. And also this remission continues for 3 years without additional therapy, which is also surprising. Not only the rheumatoid arthritis, there's famous autoimmune disease we call Sjogren's syndrome. It's characterized by dry eyes and dry mouth. And the SSA autoantibody is the cause of the Sjogren's syndrome. And you see that after treatment, within 2 weeks, the production of SSA autoantibody was dramatically suppressed after the MSC treatment. And also, this treatment restores dry mouth, which was calculated by the saliva flow rate. And this is a summary of the difference of the conventional therapy, which is the steroids or immunosuppressive drugs for autoimmune or rheumatoid diseases, and compared to MSCs. So the steroids and both steroids and immunosuppressive drugs, they decrease the blood flow, which may cause the aging. However, MSCs increase the blood flow, which may act as the anti-aging, which is a huge difference. Both treatment can treat the autoimmune rheumatoid diseases, but the side effect or the effect is completely opposite. This is very important, I think, because no one wants to be aged, right? People normally want anti-aging, right? So I prefer the MSC treatment. So I can say that this is a super advanced therapy for autoimmune diseases. But this is not only the case, because MSCs may restore the functional loss of the brain damage. It's already known that MSCs promote the neurogenesis. So you can see there's a lot of explanation, because MSC promote neurogenesis, reduce apoptotic cell death, or increase axonal remyelination. There's a lot. And also, MSC protect the neuron from the inflammation through the reduction of the T cell activation or macrophage infiltration, blah, 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 right? This is how you get the MSCs from your body. There's 5 steps. First, harvest cells from your fat tissue. And second, isolate and culture the MSCs. Third, you can intravenously inject the MSCs, which numbers are 100 million. And then these injected MSCs accumulates in the damaged sites and restore the functional loss. So if you normally get stroke, after the post-stroke, you normally get the rehabilitation. However, in some cases, rehabilitation is not enough to fully recover your damage, right? But here's one paper from Japanese that the 12 patients with the post-stroke received the intravenously MSC treatment 36 to 33 days post-stroke, and they experienced the rapid improvement of neurological status, which is scored by the IHSS score, and the recovery maintained for almost 1 year. This is one of the exam. It's a 58-year-old man, and he has a hemiplegia, and his NIHS score was initially 6. And he received a conventional therapy, but never changed. NIHS score never changed. However, after he received MSC infusion, 3 or 4 days later, NIHSS score was dramatically dropped down from 6 to 2, and the NIHSS score 2 continues until around 200 days, and then right now get 1, which means that the MSC treatment rapidly recover the NIH score. And also another paper show that the MSC treated patient had a longer survival, which was a lower mortality than the control group. So I can say that the super advanced cell therapy, it is for the brain stroke. And as I said initially, this is an ultimate anti-aging therapy because anti-aging is inevitable. Most of people believe this, right? But some of us believe that it is possible to slow down some of this effect. So the question is, can we slow the effect of the aging? In my opinion, though, the answer is yes, because there are some evidences that support healthy habits slow the effect of the aging. As a physician, I normally ask the out-clinic patient to incorporate healthy habits into daily life. However, no treatment or healthy habit stop or reverse the effect of the aging, except MSC. Not only the cellular senescence associated with atherosclerosis, there's growing evidence that the cellular senescence promotes the atherosclerosis, and this is also associated with the premature neurological aging, as the atherosclerosis plaques show the evidence of the cellular senescence, which is characterized by the reduced cell proliferation, reversible growth arrest, and apoptosis, elevated DNA damage, and epigenetic modification, and telomere shortening, and dysfunction. So the number of MSC in the body becomes 1 to 100 of the newborn when people become over 80. And this finding suggested that impaired MSC replication might cause the atherosclerosis and senescence. The atherosclerosis, as you know, they have 2 characters. One is the thickening, second, the loss of the elasticity in arterial walls. And the question is, can the atherosclerosis be healed? How do you think? The answer is no. This is currently no cure for atherosclerosis, but the condition can be slowed down with the statin drugs, dietary, or lifestyle changes. Well, another question, can the atherosclerosis plaque be reversed? The answer is no. You can keep the atherosclerosis from getting worse or stabilize the plaque by medical treatment. It's possible, or regular exercise or dietary change, but they are not able to reverse the diseases. Moreover, there's no proof that any treatment or taking supplement will cure atherosclerosis, except the mesenchymal stem cell transplantation. Of course, no evidence that is reversed naturally. So here's one paper show. So yeah, the diagnosis of atherosclerosis includes the various imaging methods, and one convenient method is to assess the artery intima media thickness, which is IMT. IMT is considered normal if it shows under 1.1 millimeter, and it shows over 1.1, which is associated with a significant coronary artery stenosis. In this slide, the 29 patients with abnormal IMT, which is over 1.1 millimeter values before treatment, and they have a significant decrease in the IMT values, which was found in after therapy. Cardio vascular index, which we call CAVI, is a stiffness and arteriosclerosis indicator. CAVI is measured at rest and considered normal if the CAVI shows under 8, borderline between 8 and 9, and abnormal over 9, which is associated with a significant coronary artery stenosis. In the patient with the pre-treatment abnormal CAVI values, which is over 8.0, 21 over 22, which is 96%, had improved values after the treatment. And it is known that dyslipidemia, so this is also characterized by low HDL cholesterol levels or high LDL cholesterol levels. This drives atherosclerosis. And the same paper, in the 12 patients with abnormal HDL values, which is under 40 milligram per DL before treatment, 11 of the 12, which is a 91.7%, showed improvement in the values. And also, in addition, 8 patients who had abnormal LDL levels before treatment, 6 revealed diseases in LDL cholesterol levels after the treatment. And insulin resistance are also known as the impaired insulin sensitivity, which happens when your cells in your body do not respond as they should do to insulin, which means they cannot efficiently take up the glucose from your blood and restore it. This is insulin resistance. As a result, your pancreas makes more insulin to try to overcome your increasing blood glucose levels. This is called hyperinsulinemia. If your cells become too resistant to insulin, it leads to the elevated blood glucose level, which over time leads to the type 2 diabetes. Type 2 diabetes is associated with several other conditions, including atherosclerosis, aging, and cardiovascular diseases. So this data shows, this data target the patient with the type 2 diabetes, and they have a two group. One group received MSCs and others a control group. And you can see the MSC treated group, right? Show the lower hemoglobin A1C levels compared to the control group. And also, they show MSC treated patients show that their required insulin dose is dramatically dropped down after treatment. It continues almost 36 months, which is almost 3 years. And also, it is known that the dysfunction of the mitochondria drives atherosclerosis. And the mitochondria are the membrane-bound cell organelles that generate the most of the chemical energy, which is needed to power the cell's biochemical reaction. Chemical energy produced by the mitochondria is stored in a small molecule which is called the adenosine triphosphate, right? Here's the function of the mitochondria. And the stress may cause the dysfunction of mitochondria, which may cause the sarcopenia, heart failure, degenerative neuron diseases, pancreatic beta cell dysfunction, and immune dysfunction. So this is the very surprising data for me. And what they show is the healthy MSC can donate the mitochondria or calcium or magnesium ion RNAs, protein, peptides to the damaged cells. And then the damaged cells who receive the mitochondria restore their function. This is very amazing, right? And also, autonomic nervous system disorders drives atherosclerosis. The paper from the Nature Medicine, they show that the autonomic nervous system disorder is associated with the loss of MSCs, and MSCs regulate the vascular endothelial function. So because of that, the loss of MSC result in the vascular endothelial senescence. So right now can say that the autonomic nervous system regulate the MSC's function, and also MSC regulate the autonomic nervous system. And this combination is very important to regulate the atherosclerosis progression. Also, it's known that the immune dysregulation, which is systemic inflammation, drives atherosclerosis. And also physical inactivity due to bone fracture or muscle weakness also drives atherosclerosis. And already know that the immune dysregulation was regulated by the MSC's treatment. And also MSC restore the bone loss during a fracture repair and promote the regeneration of the skeletal muscle. And it is known that the mental stress, insomnia, depression drives atherosclerosis. But sorry for that. The evidence is accumulating that the MSC can suppress or control the mental stress or insomnia or depression. So it might be possible that the MSC can regulate atherosclerosis through the control of the mental stress or insomnia or depression. So this is So this is the whole story. And I will like to, if you have any question, please feel free to contact me at any time, and I will respond to you back as soon as possible by email. And thank you for your attention.